Hello friends, hi, good morning. Welcome to my channel, The Voice of Nurse. Today is our new beginning, new subject related to nursing foundation or fundamentals of nursing. Now we are going to discuss the fundamentals of nursing related important, very important questions and answers with explanation. In this video, we will cover 40 questions regarding fundamentals of nursing. Before moving on to topic, I will ask you one question friends. Actually, in fundamentals of nursing, we are having so many general questions related to, I will explain you important questions like nursing is a profession, nursing related words, nursing word come from, and related to Florence Nightingale, and related to hospital general examination and physical examination, related to vital signs and normal values, ethics, and PHC, ECN, ESI, healthcare delivery system related questions. These all are questions are normally we know, but if anybody was interested about these topics, please share your opinion with me in a comment box. I will make these all topics in a separate video. Till today, we already finished related nursing subjects, nutrition point of view 100 questions, and anatomy point of view 100 questions, and also midwifery and gynecology point of view 100 questions. And additionally, we already finished NHM 2022 2 papers and NHM 2023 this year January 2023 paper also we already finished. Till now we already completed 3 subjects, and today we will discuss fundamentals of nursing. Before moving on to topic, a small request friends. Anybody watching first time my channel, subscribe my channel, click on the bell icon for further notification. Let's move on to topic now. Fundamentals of nursing. First question. A head injury patient which alarming event soft surface show ill patients. Means a patient is having head injury. That head injury patient is having alarming with soft surface show ill patient. We will see the options here. Option A tachycardia, option B hypotension, option C hypoglycemia, option D ear bleeding. Here option D is the correct answer, ear bleeding. Ear bleeding after a hit or blow to the head could be from bleeding in the brain. Head injuries may also cause bleeding in the brain tissue and the layers of the brain. The surroundings area of the brain, the hemorrhage will be happen. For example, subarachnoid hemorrhage and subdural hematoma and epidural hematoma. Here head injury patient is having event of alarming is ear bleeding. Option D here correct answer. Next we'll move on to question number 2. Decannulization means. Here what is meaning of decannulization? We will see the options. Option A IV cannula removal. Option B IV cannula insertion. Option C tracheostomy removal. Option D tracheostomy. Here decannulization means removal of tube, means tracheostomy tube. Here option C is the correct answer. Decannulization means removal of the tracheostomy tube. Decannulation is the permanent removal of a cannula is called as extubation. Intubation patient, we have to extubate that patient with the decannulization, means we have to remove the tracheostomy tube. Especially of tracheostomy cannula, once a physician determines patient is okay, means patient is recovered, patient is tolerating with oxygen and without support of tracheostomy, means physician determines it is no longer needed for breathing through the tracheostomy tube. So we have to decannulate. So here decannulation means option C tracheostomy removal is the correct answer. Here in this picture we can see here in tracheostomy tube. The tracheostomy tube wired pipe inserted to the trachea for the prolonged ventilation, means long period of ventilation purpose we are using tracheostomy for ventilation. Next move on to question number 3. Ringer's lactate means oral. Ringer lactate IV infusion, intravenous infusion solution does not contain which of the following? Ringer lactate we are using in a IV infusion, but here in this from the options there is no contains included in the ringer lactate. We will see the options here. Option A sodium, option B potassium, option C bicarbonate and option D chloride. Here option C is not contains in ringer lactate. Option C is the except of the ringer lactate. I will explain here. Sodium, chloride, potassium, calcium and lactate in the form of the sodium lactate. It contains lactate which is converted to bicarbonate for correction of metabolic acidosis also sometimes. But in the ringer lactate that bicarbonate is not contained. So here option C is correct answer. Here in this picture we can see the ringer lactate oral in the form of oral. Next move on to question number 4. Records and reports are maintained as. We will see the options. Option A assess the treatment needs. Option B avoid audit. Option C avoid duplication of efforts and option D improve patient care. Reports is an essential tool of communication, aid to studying health conditions and aid in planning interrupted to the services and development of clinical facilities and provide sufficient care and through the records and reports. As a nurse, we have to maintain all records properly and we have to maintain reports clearly. Records like admission record, discharge record and intra-patient means inpatient record also. During procedures also we have to mention a separate books. We have to record all those things and reports. We have to maintain report books also. Report book also we have to maintain. Here records and reports books are maintained to improve a patient care. Here option D is the correct answer. Records and reports are maintained for a improvement of the patient care. Next move on to question number 5. Angiography. Angiography is X-ray visualization of. We will see the options here. Option A liver, option B lungs, option C heart and option D blood vessels. Here angiography is a type of X-ray used to check blood vessels. Option D is the correct answer. The visualization of the blood vessels is a angiography for the X-ray. Blood vessels do not show clearly on a normal X-ray. So, a special dye called as contrast agent needs to be injected into the client blood first. Then they will go for angiography X-ray. Through this method can see blood vessels clearly, whether it is any abnormality is there in blood vessels and also any narrowing of the blood vessels in the heart. We have to assess the X-ray of angiography visualization of blood vessels. Here option D is the correct answer. Here we can see in this picture X-ray, angiography X-ray. We can see here angiography X-ray for visualization of the blood vessels through the angiography. Next move on to question number 6. Which of the following is not found in urine? From the following option, we are not found in urine. Options. Option A only glucose, option B only protein, option C RBC and option D all of the above. Usually glucose, ketones, proteins and bilirubin are not detectable in urine. Here option D all of the above is the correct answer. We can't detect the glucose, protein and RBC levels in the urine. We can found in urine acidity of urine means pH of the urine and sugar levels of the not blood, here urine only. In urine we can found acidity, pH, sugar, blood concentration, bilirubin levels and evidence of infection. Example pus cells. We will see pus cells also in the urine examination. Here which of the following is not found in urine is glucose, protein, ketones and bilirubin. But here bilirubin is not there in the option. All of the above is the option here, correct answer. Next move on to question number 7. A client condition following cardiac catheterization is evaluated by palpating the pulse. Here post cardiac catheterization, nurse to evaluate the palpation of the pulse means evaluate whether palpation of the pulse means we have to assess, where we have to assess. We will see the options here. Option A, in all extremities. Option B, distal to the catheter insertion. Option C, at the insertion site. And option D, above the catheter insertion. To evaluate a patient or client condition following cardiac catheterization, palpation of the distal pulse is the correct answer. The distal to the catheter insertion, option B is the correct answer here. But here additionally I will explain the role of the nurse. Nurse should check temperature, not only temperature, nurse should check all of the vitals, respiration, pulse, temperature and BP. We have to check the vitals after cardiac catheterization, and we should check the pulse also, palpation of the distal pulse, and especially we have to monitor whether any side bleeding from the area of the cardiac catheterization, and capillary return to use it to the limbs also. We have to check the discoloration of the limbs. Most probably some of the patient is having hematoma at the site of cardiac catheterization, so that one also major issue. So nurse should have to check the hematoma formation at the site of cardiac catheterization. Here the cardiac catheterization evaluating the pulse by distal to the catheter insertion, option B is the correct answer. Next we will move on to question number 8. The 8th question is, which is the correct step of eye care? From the following options we are having one of the step of eye care. We will see the options first. Option A, inner canthus to outer canthus. Option B, medial to inner canthus. Option C, outer to medial. Option D, outer canthus to inner canthus. Here option A, inner canthus to outer canthus is the step of the eye care, and a simple hygiene measure to showing how to clean the eyes without risk of cross infection. When cleaning the eyelid, nurse should clean from the inner canthus to outer canthus. So while using this step, we can decreases risk of infection. So here the step of eye care from the following options, option A is the correct answer, inner canthus to outer canthus. Here we can see the eyes, inner canthus and outer canthus. The placement of the inner canthus and outer canthus. Next move on to question number 9. The full form of Ambu bag is. What is the full form of Ambu bag? Options. Option A, airway mouth breathing unit. Option B, artificial manual breathing unit. Option C, artificial mouth breathing unit. Option D, none of the above from the following options. Here Ambu bag is a handheld tool that is used to deliver positive pressure ventilation, PPV ventilation, for any subject with insufficient breath. One person is suffering means we can provide a PPV, pressure positive pressure ventilation, through the artificial manual breathing unit. So Ambu bag means artificial manual breathing unit. Option B is the correct answer. Ambu bag consists of self-inflating bag, one mask and oxygen reservoir. Additionally, I will explain one more thing. Ambu bag is invited by Testa Laboratory. With Ambu bag can assist in performing during CPR in emergency situation and life-threatening situations also. Ambu bag is very important and life-saving equipment also. Next move on to question number 10. The heartbeat rate of newborn babies is generally. We will see the options here. Option A 90 beats per minute, option B 80 beats per minute, option C 72 beats per minute, option D 120 beats per minute. 120 to 140 beats per minute. Here normal heartbeat rate of newborn babies is 120 to 160 beats per minute. If maybe much lower when the infant is sleeping, means the respiration is 30 to 60 breaths at the age of 0 to 6 months. And also blood pressure I will explain, 65 to 90 by 45 mm of Hg. Systolic pressure is 60 to 90 and diastolic pressure is 45 mm of Hg. This is additional point. Here the heart rate of the newborn babies is 120 to 140 beats per minute. Option D is the correct answer. But normal range is 120 to 160 beats per minute. Nearby option C here. Option D is there. So option D is the correct answer. Next move on to question number 11. Objective data collection method accept. Here in this option, the objective data collection method one is the accept option. We will see the options here. Option A group discussion, option B panel discussion, option C demonstration, and option D interview. The objective data information. Objective data is a information observed through your senses of example hearing, sight, smell and touching while assessing the patient. For example, vital signs and physical examination and also laboratory result. Here group discussion, panel discussion, demonstration is the methods of objective data. But here accept method of objective data collection is interview. Through the group discussion, panel discussion and demonstration, these methods acts a very vital tool for collection data from the patient, providing complete care and also give a good outcome. Next move on to question number 12. The choice of TURP solution at irrigation time. The choice of TURP solution is using at the time of irrigation. What is TURP? Transurethral resection of the prostate. Here TURP, TURP means transurethral resection of the prostate gland. Here we will see the options first. Option A NS, option B plain water, option C glycerol and option D all of the above. During the irrigation procedure, fluids were slightly hypoosmolar solutions of glycine and sorbitol or glucose. Option C is the correct answer, glycerol. The choice of TURP solution for the irrigation time. During the procedure of TURP, the choice of solution is irrigation time is glycerol. Option C is the correct answer here. Next move on to question number 13. Which of the following is not a parameter of Glasgow coma scale? Here the one of the not parameter of Glasgow coma scale. We will see the options here. Option A verbal response, option B intubated patient, option C eye opening and option D motor response. Here in the Glasgow coma scale, why we have to use the Glasgow coma scale? What is the use of Glasgow coma scale? The scale is assessing patient according to the three aspects of responsiveness, eye opening, motor and verbal response. Here we are having three aspects of responsiveness of the patient. Those are eye opening and motor response and verbal response. Here option A and C, D is included in the parameters of the Glasgow coma scale. Here intubated patient means option B is the except parameter in the Glasgow coma scale. Here we can see in this picture Glasgow coma scale. Additionally, I will explain intubated patient. If patient is intubated or other factors interfering, patient is not ability to communicate verbally, we can't do a Glasgow coma scale for assessing the patient condition. So patient is intubated, not conscious means we have to avoid the Glasgow Coma scale assessment. So you have to write NT means not testable patient. So here option B accepted in the Glasgow Coma parameters. Next move on to question number 14. Color coding for nitrous oxide cylinder. We will see the options. Option A black, option B grey, option C French blue, option D black with white shoulder. The color coding for nitrous oxide is French blue color. Option C is the correct answer. The color codes are varied for body and shoulders of the cylinder. For example, nitrogen cylinder comes with a grey color body and black color shoulders colored with a cylinder. Here we will see additionally option A black color. Black color cylinder code is nitrogen. Next option B grey colored. Option B grey colored color coding for cylinder is carbon dioxide cylinder. Next option D black with white shoulders is oxygen cylinder. Here in this question color coding for nitrous oxide is option C French blue color is the correct answer. Here we can see the French blue color coding nitrous oxide cylinder in this picture. Next move on to question number 15. The patient has a right to get off medical records. The patient have a right to get a medical records. We will see the options here. Option A email, option B scanning, option C photocopy, option D virginals. Means photocopy means nothing but is Xerox, friends. Here option C photocopy means Xerox. The patient have a right to get a medical records in a form of copy, photocopy or Xerox. The medical records are obligatory for doctors and hospitals to provide a copy of the case record and medical record to the patient. For example, patient history, clinical findings and diagnostic test related results, and in case patient undergone surgery means pre and post operative care and pre and post operative laboratory reports and patient progress and also discharge summary, these all things, and medicines, medication history also we have to provide a photocopy to the patient. This is the patient right to get a medical records. Option C photocopy or Xerox is the correct answer here. Next we will move on to question number 16. The percentage of formaldehyde in concentrated formalin. How much percentage of formaldehyde in concentrated in formalin? We will see the options here. Option A 30%, option B 50%, option C 80% and option D 40%. Here percentage of formaldehyde in concentrated formalin is option D 40% is the correct answer. 40% of formaldehyde is concentrated in formalin. Option D is the correct answer, 40%. Next move on to question number 17. Most common cause of pulmonary embolism. Most common cause of pulmonary embolism. We will see the options here. Option A neoplasm, option B DVT. DVT means deep vein thrombosis. Option C pulmonary hypertension and option D pulmonary hypotension. Here the pulmonary embolism occurs when a clump of material, most often a blood clots, gets stuck in a artery in the lungs or heart. Blocking the flow of blood is make a blood clots. Most commonly come from the deep veins of our legs. Condition is called as DVT. Option B is the correct answer here. Most common cause of pulmonary embolism is DVT, deep vein thrombosis. Here we can see in this picture from we are getting deep vein thrombosis from the legs. Here we can see in this picture one of the portion of the DVT we are seeing in right side of the part. Here most common cause of pulmonary embolism is DVT. Next move on to question number 18. The 18th question is, which of the following involves the injection of radioisotopes into the body? Here we are using a injection to the body for the radioisotopes into the our body. We will see the options. Option A, PET, option B, CT scan, option C, radiography, option D, angiogram. Here option A is the correct answer, PET. It is a PET scan. PET scan, one of the type of scan. Most commonly used isotopes in PET scan is fluorine 18. While during the PET scan, stay calm. Patient should stay calm and not to talk while the scanner takes pictures of body, which usually takes up to 30 minutes. Total visualization of the our body is done in this PET scan for identification of blood clots and any abnormalities related to the blood vessels and in all over the body. The radioisotopes used in the PET scan, here option A is the correct answer. Next we will move on to question number 19. Which position given to patient in sigmoidoscopy? The sigmoidoscopy, which position we are giving to the patient? Options: option A, sitting position, option B, knee chest position, option C, prone position, option D, lithotomy position. The position is given to the patient while during the sigmoidoscopy is knee chest position. But here we have to know what is sigmoidoscopy. Additionally, sigmoidoscopy is the minimally invasive medical examination of large intestine from the rectum through the near part of the colon, the sigmoid colon. Two types we are having: the sigmoidoscopy, flexible sigmoidoscopy and rigid sigmoidoscopy. Here the position given to the patient while during the procedure, the position is knee chest position. Here we can see the knee chest position in this picture. Option B is the correct answer here. Next move on to question number 20. A bed capacity of 300 to 1000 is which hospital? A bed capacity of 300 to 1000 is which hospital? We will see the options here. Option A, large hospital, option B, small hospital, option C, PHC, and option D, Gout hospital. Sorry friends, actually here option A, not big hospital, large hospital. Option A is the correct answer. 300 to 1000 beds is available capacity is called as large hospital. Option A. Small hospital means additionally 100 beds. Whether a hospital is having 100 beds means that is called as small hospital. Medium hospital means medium hospital contains between 100 to 499 beds is available means is called as medium hospital. Large hospital means 500 or more beds is called as large hospital. Here a bed capacity of 300 to 1000 beds is in hospital. That hospital is called as large hospital. Here option A is the correct answer. Next we will move on to question number 21. Here DX means we will see the options. Option A, date of diagnosis, option B, death, option C, diagnosis, and option D, department. Here DX is the process of information gathering and clinical reasoning to determine a patient health problems means it is a diagnosis. Option C is the correct answer. Diagnosis is the process of information gathering and clinical reasoning to determine a patient's health problems. Here option C is the correct answer. Additionally, I will explain TX. TX means in medical term treatment. HX means history of the patient, and SX means symptoms of the patient. Here TX means treatment, HX means history, and SX means symptoms. But here in this question DX is there. DX means option C, diagnosis. Next we will move on to question number 22. Who is the consumer of a hospital? Who is the consumer of a hospital? We will see the options here. Option A, public. Option B, patients. Option C, health workers. And option D, none of the above. Here, the consumer of the hospital is patient. Here, option B is the correct answer. Among the type of potential consumers for the hospital is the patients and also family members. Patient, family members, and also we are having the other parties of consumers of the hospital, such as insurance companies and internal customers and insurance companies also one of the parties of consumer to the hospital, consumers of the hospital. Here in these options, option B, patients is the correct answer. Patients are the consumer of a hospital. Next, move on to question number 23. What is autonomy? What is autonomy? We will see the options here. Option A, respect. Option B, human dignity. Option C, self-determination. And option D, discipline. Autonomy means self-governance. Okay friends, here what is autonomy? Autonomy means self-governance and self-determination. Option C is the correct answer. Autonomy is about a person's ability to do actions on his or her own values and interest. Autonomy is a Greek word. Meaning of the autonomy is self-governance and self-determination. Here in this option there is no self-governance. Here option C is self-determination is there. Here what is autonomy means? Option C, self-determination is the correct answer. Next, move on to question number 24. Role of nurse in healthcare delivery system. The role of nurse in healthcare delivery system. We will see the options here. Option A, be prepared to work. Option B, direct accessibility. Option C, show interest. And option D, involve in political field. Here, all of the above option E. Here, role of the nurse healthcare delivery system is option E. All of the above is the correct answer. Care and maintenance and also direct patient care is the prime responsibility of nurses. Includes health education and family counseling and also self-help skills, infection control measures and medication and treatment records and reports also. Those all things included into the healthcare delivery system. The role of nurse, we have to record and report also. This is the major point in role of nurse. Be prepared to work, direct accessibility, show interest in own and also involvement of the field of the procedures. Here option E is the correct answer. All of the above is included into the healthcare delivery system. The role of nurse. Next, move on to question number 25. The appropriate size of rectal tube to be used for giving enema for infant. What is the appropriate size of rectal tube to giving a enema for a infant baby? We will see the options here. Option A, 11 French. Option B, 22 French. Option C, 12 French. Option D, 24 French. The appropriate size of rectal tube, recommended amount of saline prescribed by the doctor and mixing the recommended ingredients. We have to deliver enema through the soft silicone tube like a Foley's catheter. Soft silicone tube is a Foley's catheter. The infant enema, we have to use microlax enema up to 3 years of age. Not only infant, from the born baby to under the 3 years we are using now microlax enema. Thus with the soft silicone tube, here we are seeing in this Foley's catheter. Through the Foley's catheter we have to deliver a enema in infant baby is 12 French. Option C is the correct answer here. The appropriate size of rectal tube to be used in giving enema to the infant is 12 French. Next, move on to question number 26. The core of nursing. The core of nursing. Options: Option A, prevention of illness. Option B, family and society. Option C, alleviation of nursing. And option D, restoration of health. And option E, all of the above. Here, the core of nursing means caring is best demonstrated by a nurse's ability to embody the five cores in values is there. Here in core of nursing, we are having five core values of professional nursing, included human dignity, integrity, autonomy, altruism, and also social justice. Here, all of the above is the correct answer: prevention of illness, family and society, elevation of nursing care, and restoration of health, and also social justice. These all things we have to apply in clinical practice. Here, core of the nursing is option E. All of the above is the correct answer. Next, we will move on to question number 27. Science is the body of. What is the science? The body. We will see the options here. Option A, art. Option B, facts. Option C, knowledge. Option D, practice. Science can be thoughts of a body is called as knowledge. Option C is the correct answer. Science can be thought of a body of knowledge which is the build-up of through experimental testing of our ideas. Here option C, science is a body of knowledge. Option C is the correct answer. Next we will move on to question number 28. Spiral bandage is most suitable for. The spiral bandage is most suitable for options. Option A, chest. Option B, perineum. Option C, abdomen. And option D, arm. Spiral bandages are usually used for a cylindrical part of our body. Spiral bandage provides support for damaged muscle tissues and decreases the infection and increases the wound healing. Here the spiral bandage is most suitable for the cylindrical part is option D, arm. Arm is the correct answer. Here we can see the spiral bandage. Next move on to question number 29. Bacteriostat. Bacteriostat is options. Option A, improves bacterial growth. Option B, inhibits bacterial growth. Option C, suppress virus infection. Option D, improves the health. Bacteriostat, a substances or preparation that inhibits further growth of bacteria is called as bacteriostat. Here option B is the correct answer. Bacteriostat is inhibits the bacterial growth. For example, bacteriostat antibiotics suppress the growth of bacteria is tetracycline, one of the type of antibiotic, and also clindamycin, also one of the type of antibiotic to inhibits the bacterial growth. Here option B is the correct answer. Next move on to question number 30. Medical fermentation is, we will see the options. Option A, application of cool on area. Option B, application of local moist heat. Option C, application of hot on area. Option D, none of the above. Medical fermentation means application of local moist heat. Option B is the correct answer here. Moist heat therapy includes a wet heat source used to soothe and relax the sore muscles and joints and ligaments. It can be decreases the pain also. Here medical fermentation means application of local moist heat. Option B is the correct answer here. Next we will move on to question number 31. The Thomas splint. The Thomas splint is used in case of options. Option A, fracture of shaft of femur. Option B, skeletal or skin fracture. Option C, fracture of clavicle bone. Option D, all of the above. Here Thomas splint is used in case of fracture of shaft of femur. The long straight part of the femur is called as femoral shaft. When There is a break anywhere along this length of bone is called as shaft fracture. In case of the femoral shaft fracture is happened breakdown means this is called as shaft fracture. The Thomas splint is used in case of fracture of the shaft of the femur. Here option A is the correct answer. Next we will move on to question number 32. The gauge of needle used in intradermal injection. What is the gauge of needle is using for intradermal injections? Options: option A 12 to 14 gauge, option B 20 to 26 gauge, option C 28 gauge, and option D 16 gauge. Intradermal are administered. Intradermal injection are administered into the dermis just below the epidermis. Here option B is the correct answer. 20 to 26 gauge is the needle we are using in intradermal injection. Tuberculin syringe calibrate in a tenth and hundredth of milliliter with a needle length of 1/4 to 1/2 inches. Gauge of 25 to 27 needle is the intradermal injection we are using. Here gauge of needle is used intradermal injection in this option. Option B is the correct answer. Next move on to question number 33. Skeletal traction is options. Option A skeleton, option B Russell's traction, option C Steinman pin and K-wire, option D none of the above. Here skeletal traction is using in this option. Option C Steinman pin and Kirschen wire or K-wire. Utilizing a skeletal traction technique to restore movements in a contracted joint typically requires percutaneous insertion of a Steinman pin and K-wire. Here Steinman pin and K-wire through the radius for the elbow joint and tibia for the knee joint. We can do the traction to the elbow joint and tibia for the knee joint. Here we can use the tibia for the knee joint and elbow joint also radius for the elbow joint we can use. Here in this picture we are seeing skeletal traction while using Steinman pin and K-wire. Here option C is the correct answer. Move on to question number 34. Urine is called as in kidneys. Options: option A water, option B urea, option C specimen, and option D all of the above. In the kidney, the urine is called as urea. Option B is the correct answer. Kidney make urine by filtrating waste and extra water from the blood. The waste is called as urea. Here in the kidney, urine is called as urea. Kidney make urine by filtrating waste and extra water from the blood. The waste is called as urea. Here option B is the correct answer. Next we will move on to question number 35. The 35th question is the size of nasal catheter used to administer oxygen for a woman. Which is the size we are using to administer a nasal catheter to a woman? We will see the options. Option A 10 to 12 French, option B 20 to 22 French, option C 10 to 20 French, and option D 12 to 14 French. Here option A 10 to 12 French nasal catheter is used to administer oxygen for a woman. Here option A is the correct answer. Actually we are having three basic sizes of nasal catheters for an adult and pediatric and also infant. Here we are seeing the nasal catheter administer oxygen for a woman. This is the adult nasal catheter. Here option A is the correct answer, 10 to 12 French. Next move on to question number 36. The cervical plexus are options. Option A nerve supplied to cervix, option B first four cervical nerves, option C A and B, option D none of the above. Here cervical plexus or first four cervical nerves, option B is the correct answer. Cervical plexus is a complex neurologic structure located within the head and neck. Here C1 to C4 nerves are cervical plexus, and also greater auricular nerve, lesser occipital nerve and transverse cervical nerve, and suprasternal and supraclavicular nerves also included in this cervical plexus. I will repeat again the first four cervical nerves. C1 to C4 nerves are great auricular nerve, lesser occiput nerve and transverse cervical, suprasternal and supraclavicular nerves. Here cervical plexus or first four cervical nerves is the correct answer, option B. Next we will move on to question number 37. For a blood urea analysis, the specimen can be collected in blood having. Means for a blood urea analysis, which specimen bottle we are collecting a blood urea. We will see the options here. Option A, potassium oxalate. Option B, carbon dioxide. Option C, natural gas. Option D, none of the above. The blood urea analysis specimen we are collecting bottle is potassium oxalate. Option A is the correct answer. The potassium oxalate is used to preserve glucose in a whole body, and for some special chemistry test also we are doing in the same specimen bottle. But bottle color is grey, top tube is there. Here we can see in this picture the potassium oxalate specimen tube. The blood urea analysis specimen we are collecting in bottle is potassium oxalate, grey top tube. Next we will move on to question number 38 here. Loss of person or object is. Loss of a person or object is called as options. Option A, actual loss. Option B, perceived loss. Option C, nature loss. And option D, situational loss. Here the loss of a person or object is called as actual loss. Actual loss that occurs when an insured property is destroyed or damaged to such as a either recovered or not repaired for a further use. Here option A is the correct answer. In case of loss of a person or loss of object is called as actual loss. In case of we are losing a property destroyed or damaged such as not recovered or it may be recovered is called as actual loss. Here option A is the correct answer. Next we will move on to question number 39. The word lavage means. The word lavage means options. Option A, remove. Option B, discard. Option C, to wash out. Option D, all of the above. The lavage is a washing, especially the therapeutic washing out of a organs or part. Here option C is the correct answer. Lavage means to wash out. For example, stomach or colon wash. Wound by flushing it with a fluid is called as irrigation. Through the irrigation procedure also we are doing a lavage procedure. Here lavage means to wash out. Option C is the correct answer here. Next we will move on to question number 40. This is the last question in this video. We will continue from the 41 question for the next part 2 video. We will move on to question number 40 now. Euthanasia literally means. Euthanasia literally means, we will see the options here. Option A, die. Option B, mercy killing. Option C, caring. And option D, patient. Here euthanasia means mercy killing. Option B is the correct answer. Euthanasia is an act of killing someone who is very ill or very old so that they do not suffer anymore. Here euthanasia means mercy killing is the correct option here. For easily I will tell you, euthanasia means painless killing of patients suffering from a painful disease or old, very old age. We painless killing of patients suffering from a painful situation and painful disease is called as euthanasia. Option B, mercy killing is the correct answer here. Next, from the 41 question, I will continue. Next video, part 2, fundamentals of nursing, we will discuss from the 41 question. This is the part 1 video from the first to 40 questions. And one more thing, anybody want regarding introduction of fundamentals and general topics related to fundamentals of nursing means, just give a comment in the comment box. I will explain clearly with questions and answers with explanation. Keep watching friends. Stay tuned. We will meet on next video. Thank you for watching my video. Thank you so much for your support, and whoever watching my channel first time, please subscribe my channel, give a like, share the video and click on the bell icon.